Oh, thank you, Scott and Karen and Mary. So Mary just gave a great macro level overview of the national landscape. I'm going to be giving you an overview of my research that's focused on the individual farm household level to try to understand the lived experience with health insurance and how health insurance ties into economic development and quality of life for our nation's farmers and ranchers. So briefly, I'm going to give you an overview of why we should be studying farmers and ranchers and health insurance and how it links to workforce development in the agriculture sector. Then share with you the results of two national studies. One was conducted 8 years ago in 2007, before the Affordable Care Act was ever even debated as a policy. The second was conducted more recently in 2014, and then discuss how this background research fits into a new research and extension project titled Health Insurance, Rural Economic Development and Agriculture that more comprehensively examines this issue. So to follow up on Mary's presentation, the CDC recognizes that farming is one of the most dangerous occupations in the U.S. Farmers, their family members, and farm workers are exposed to numerous health, environmental, and safety hazards. And they are at extremely high risk for fatal and non-fatal injuries and illnesses that can result in lost work time and permanent impairment. If an operator, a family member, or an employee is unavailable due to a health problem from an accident or illness, it can have serious negative repercussions for production, marketing, and management. And really the ability for farmers to manage a health problem and recover is dependent on access to care. Secondly, farm and ranch families have historically pieced together household income and health insurance benefits through a variety of on and off-farm employment strategies, as Mary said, often seeking off-farm employment for health insurance. 52% of operators today have a different occupation other than farming. Off-farm health care benefits can relieve the farm from insurance expenses and reduce the unspoken stress of what might happen from an injury or illness, but it decreases time and energy available for farming and marketing. It also creates the need to hire additional part-time labor who themselves often do not receive health benefits. So this can really complicate initiatives to create a new economy based on food and agriculture that offers high-quality jobs and enhances employer and employee quality of life. There have also been a variety of studies and reports forecasting that the ACA should increase entrepreneurship and allow individuals to leave jobs that they kept primarily for the health insurance benefits. This is the phenomenon known as job lock. Right now, we don't understand how this phenomenon is going to play out in the agricultural sector. Finally, federal and state reforms brought through the ACA have implications for how farmers and ranchers source health insurance for themselves, their families, and as Mary said, the requirements for employee-mandated health insurance. So Mary mentioned the difference in state policy environments. So in addition to the differences that are implemented at the federal level of whether or not a state has expanded Medicaid, states can also choose to implement their own laws. So for example, here in Vermont, employers are required to provide insurance if they have 4 or more full-time employees, seasonal labor counts, and then we also have 3 different definitions of seasonal labor. So differences in how reforms are implemented across the country may lead to real variation in health insurance use and coverage with implications for farmers, their families, and farm workers. So we know that there's a link between economic development, workforce development, and job quality. And you can take a moment to reflect on your own job quality. What were the reasons why you chose your current job? What role did your interest in the type of work play? How important was your salary, job security, work schedule, opportunities for advancement, and how did the benefits package influence your decision to enter and stay in your particular occupation? So nationally, there's been an increasing attention and interest in supporting our farmers and ranchers and creating economic development through food and agriculture. Our conversation has really tended to focus on support around markets, land use, regulations, skill development, and risk management. We've spent less time discussing the quality of these jobs. And when we think about workforce development, there are a variety of factors that impact job quality, one of which is benefits, and that's the focus of my research. So as a rural sociologist, much of my research has focused on understanding farm growth and persistence in counties experiencing urban development pressure, what's also known as the rural-urban interface, or RUI. So the RUI is actually of great interest to policymakers because even though counties that are considered to be at the RUI only account for 20% of all counties, they actually account for about 40% of all U.S. agricultural sales. And over 90% of our fruits, vegetables, and nursery greenhouse crops come from these counties. And on this map, you can see it's those dark blue counties. Due to their close location to dense urban markets, they're increasingly relevant to conversations about local foods. So agriculture in these counties face both opportunities and challenges. And over the last 10 years, I've been working in 10 case study metro regions around the country, interviewing and surveying farmers and ranchers to understand the factors influencing enterprise growth and persistence. And you can see these 10 sites on this map. These sites may be close to where you live and work. In one study that we did 8 years ago in 2007, in 5 of the counties you see on the map, we asked farmers about 20 different indicators that could be impacting the future of their farm. Given the urban development pressure, we expected to see cost of land, inputs, planning and zoning regulations as major challenges. We were very surprised when we analyzed the results and found it was the cost of health insurance that was the most serious problem for the future of the farm enterprise. It's particularly, again, noteworthy to again note that this data was collected in 2007, well before there was ever any mention of the ACA. When we broke the data out further into different types of farmers, we found that 66% of commercial farmers, that's those who are making the majority of their household income from farming, identified health insurance as the most serious threat to their farm that trumped the cost of land, inputs, and development pressure. Insurance costs and high rates of underinsured farmers can have severe consequences for farm productivity and viability. As one farmer said, 2 things are working hard against the configuration of the business. One is rising land value, and the other is rising healthcare costs that have gone completely out of control. Healthcare costs are driving everything. So in 2011, we had a USDA small and medium farm grant to examine how farm families at the RUI are balancing family goals. And I was able to use this survey to ask some basic health insurance questions. So as you know, the ACA was signed into law in 2010, and implementation was phased in across a few years. So the qualitative and quantitative data I'm going to share was collected between 2012 and 2014. So some of it in the very early years of the ACA. And again, this is on a sample of small and medium farmers. This table shows our 5 case study metro regions. There's one in each region of the country. When we look at their policy environments, we can see that they're also very different, with 3 of the states having expanded Medicaid and 3 states opting for a federal rather than a state-run marketplace. Being in the case study communities, we heard a wide range of stories from different types of farmers. First, I want to focus on the decision farmers must make for themselves and their families. Health insurance was a much more salient issue for first-generation farmers. They actually tended to mention this issue twice as frequently as did multi-generation farmers. Farmers told us stories about how they or their spouse work off-farm just for the health benefits, but would prefer to be working full-time on the farm. Others work solely on the farm but pay out of pocket for health insurance, and others couldn't afford to buy health insurance and expressed concern about the dangers of their work and the need for more preventative medicine that individual market policies were not covering. It was particularly interesting to also hear about health insurance needs and challenges change along the life course. Older farmers use a combination of Medicare and private insurance, such as Medicare supplemental insurance, while farmers starting to farm as a second career were more likely to purchase individual market plans. Many older farmers cited planning for healthcare costs in retirement as a significant challenge. Younger families identified the biggest struggle with health insurance coverage with young children. Families were able to cover children through state-run children's health insurance programs, CHIP, which are means tested where parents qualify based on income. But in many of these cases, the parents often remained uninsured or underinsured. Farm families reported feeling trapped in order to qualify these programs because they needed to juggle their income and employment, with many deferring job opportunities offering extra income that could assist with cash flow and farm development, but would make them ineligible for health insurance benefits for their children. When we looked at the issues farmers face as employers, farmers describe how the cost of health insurance influences their decision to expand their operation. Expansion often requires additional employees. However, the cost and paperwork associated with health insurance plans and workers' compensation tended to disincentivize and dissuade farmers from expanding. Many voiced their frustration over their inability to offer health benefits to their employees and their families. Farmers frequently recognized health benefits were important for employee health and welfare, and they vocally recognized healthier employees can invest more time and energy into their work. A number of farmers actually identified offering health insurance options to their employees as a future goal. Now what I'd like to do is share some of the quantitative survey results. Okay. So just to give you some basic demographics, again, this data I'm presenting is from 500 farmers, and as Mary said, I'm only focusing on those that were under 65 and not receiving Medicare. And actually the results don't actually vary all that much between the two populations. But close to half of our sample, 47%, reported working an off-farm job just for the health benefits. This was actually a very well-insured population. Close to 90% of respondents had health insurance. What's interesting to see is that of the 12.6 that were uninsured, the majority were in Maine, Florida, and Ohio, followed by Hawaii and Vermont. And Maine and Florida are two states that did not expand Medicaid. Also, as Mary mentioned, the Kaiser Family Foundation is a wonderful resource. They continuously poll Americans on their attitudes towards health insurance reform. And I used some of the questions from the Kaiser survey in order to compare the farm population to the general population. In response to the question, the ACA was signed into law in 2010. Given what you know about the law, do you have a generally favorable or unfavorable opinion of it? We see that farmers are fairly similar to the general population, with roughly 40% having an unfavorable opinion. 35% of farmers have a favorable opinion compared to 43% of the general population. But what's most interesting is that farmers are more likely to have a mixed opinion compared to the general population. Looking deeper and more specifically at some of the issues farmers and ranchers face, there's a significant percentage of farmers who are more neutral on the anticipated impacts of the ACA to their business. We often hear a great deal from the farm population about regulatory and paperwork obstacles. While 42% of farmers believe the ACA will create more unnecessary government intervention, just a quarter don't believe that this is the case, and just over 30% are neutral. The same pattern holds when asked if the ACA will create more of a paperwork headache. Again, just over a third of the sample believe it will create a paperwork headache, while just under 20% don't, and 42% are mixed in their opinion. In regards to financial stress, just about 50% of this population believes it won't decrease their financial stress, less than 20% do, and a third are neutral. We also asked questions about economic development, farm growth, and the need for off-farm employment. Under 10% of the sample agreed the ACA would allow them to expand their farm operation. 50% felt it would not, while a sizable percentage, 42%, were more neutral. Just over 10% of the sample believe the ACA would reduce their need to obtain benefits through an off-farm job, while 44% disagreed and 44% were neutral. Again, these are attitudes and not actual practices, and this was relatively early in the implementation phase. We also asked respondents if they offered health insurance to their employees. Just under 10% of respondents did. Of those that did offer their employees health insurance, the majority of farmers were in Hawaii, followed by Vermont. Hawaii and Vermont are two states with historically high rates of health insurance and have a history of implementing expanded health insurance policies before the ACA. It's also interesting to note that when we drilled further down into the data, we actually found that the majority of farmers that were offering health insurance to their employees were engaged in value-adding activities. So most likely they're offering health benefits as a way to invest in and retain a skilled workforce. We also had a series of questions on the survey asking farmers how they anticipated the ACA would benefit their family and their employees. Just under a quarter of the sample believe the ACA will benefit their families, and the remainder of the sample was evenly split between not believing it would benefit their families and being neutral on the issue. Similarly, 20% of respondents believe the ACA would benefit their employees, while 30% disagreed, while just under half were neutral. And this may be an indication of the recognition that the ACA may be beneficial to low-wage workers typically found in agriculture, and the recognition of the importance of health and health insurance for farm workers that emerged from the qualitative data. Health insurance literacy, which is the ability to pick a plan that makes the most sense for you and your family, is an issue in the general population. And again, replicating the Kaiser Family Foundation's general population survey, we asked farmers, do you feel you have enough information about insurance and healthcare to understand how it will impact you personally? So 46% of the farmers and ranchers who answered the question, yes, and that's actually a little bit lower than the general population. And what's interesting is if we look at no and unsure together, about 54% of this population said that they did not have enough information or were unsure if they had enough information about health insurance. And that is much higher than the general population. Along this issue of health insurance literacy, we asked some additional questions about health insurance education and outreach. So while approximately half of all respondents reported that they did not have all the information they needed, only less than a quarter had actually spoken to a health insurance navigator. 70% of our sample had not. Many of the marketplace eligibility guidelines are related to one's finances, especially one's taxes. So we see a fairly even split across farmers when we ask that they will seek financial advice on how to ensure maximum benefits for health insurance. And finally, we asked respondents if they were eligible to enroll in the expanded Medicare programs, would they? And again, farmers are fairly uniformly split across the responses. But as we drill down further, we also found, while that just under 30% of farmers said that they would enroll in an expanded Medicaid program if eligible, 35% of those were from states that had not expanded Medicaid. So there is interest in the program among residents in states that have not expanded Medicaid. As discussed earlier, previous studies have described how crushing medical debt can impact both the farm business and quality of life. So we asked individuals if they owed money for any health care services. The vast majority, 82%, said no, and just under 20% said yes. I just want to make a caveat that we don't know if they don't owe money because they were either well insured or if it's because they were not going to the doctor and treating a health concern. We also asked farmers if they worry about the impact of medical debt on their enterprise. 10% of the sample said yes, they worry medical debt could lead to their farm being foreclosed on. The remainder of the sample was split between those that disagree and those that have a mixed opinion, indicating that there's a great deal of nuance that needs to be teased out in thoughts and attitudes about this very personal issue that most folks actually don't want to talk about or even think about. So some conclusions from this data set are that health insurance is a real issue for farmers and it directly impacts their economic growth and quality of life. Farm insurance rates tend to reflect the insurance trends in the states that they're embedded in. Farmers do see health insurance benefits and having access to health insurance as being important for their employees. And some farmers were offering health insurance benefits as a workforce retention strategy. It's important to remember that attitudes towards health insurance reform are varied and nuanced, and we found that in our survey. For those of you who looked at the Kaiser Family Foundation, you can see how Americans' attitudes towards the ACA have changed over time. And we need to have more longitudinal data on the farm population to understand these changes. And the next issue that we really need to understand is not just if farmers are or are not insured, but if and how they're using their health insurance. So the previous studies have led us to this new project, Health Insurance, Rural Economic Development, and Agriculture, our Hired an Ag project, which was funded in 2014 through a USDA Afri grant. Myself and Dr. Alana Knutson from the Walsh Center for Rural Health Policy are leading a team from 8 different organizations and institutions representing both research and extension. And our goal is really to understand how health insurance impacts economic development, workforce vitality, and quality of life and health for our nation's farmers and ranchers. We have a website and we are posting research results as they become available, all at hiredanag.net. And just in closing, I wanted to give you a resource of articles that have been published by our research team members on this topic. There are hyperlinks to these articles embedded within this slide. And again, I just want to leave you with our project website where we are posting research and reports as they become available. And we'll also have a link to the recordings of today's webinar. Thank you.